Hi, I'm Joel Myerson, and welcome to my talk. Um, I'm an experimental psychologist by training, actually trained by Peter Colleen, who you may have heard earlier today. And I do research, or I have been doing research primarily in two areas, one of which is the choice and decision making, which Peter would not be uncomfortable with my doing. And the other is cognitive aging. I'm not sure how he quite feels about that, but but actually lately I've been studying uh, the pandemic and the effect that it's been having on people, and that sort of makes me a quasi-experimental psychologist. But here's the title of my talk. Effects of age, depression, and anxiety on pandemic mitigation behavior. Um, we have a grant from the National Institute on Aging to study. Actually, the grant was originally in response to a call for proposals on behavioral economics and aging. And that's what I thought I was going to be doing. And then along came the pandemic. Um, so the collaborators, my co-investigators on the grant are Mike Scooby, Len Green, and my wife and colleague, Sandy Hale. And also want to give special thanks to Tanya Waldeyer, who's our lab manager, who she's leaving us shortly, but she has been our lab manager and actually is responsible for collecting the data and for a lot of the analyses that I'm going to be talking about today. Hua is Len Green's graduate student, although he's about to have his uh, final dissertation defense next week. And he's the one who sort of got me started studying the pandemic, mainly by pointing out the problems of studying decision making during the pandemic when the pandemic may be altering people's decision making. So I sort of decided, well, okay, let's study that. Let's study probably some of the most important decisions that people make during the pandemic. And those have to do with mitigation behaviors, things they can do to decrease the risk that they're subject to. Um, the data that you read in the newspaper and elsewhere can be somewhat a little confusing. Mainly, you can blame the reporters uh, who do it, but they will often talk about the, the case counts. And the problem with the case counts is if you look at how they change as a function of age, you see the number of cases in the different age cohorts goes down as if people were less susceptible to the pandemic as they got older. On the other hand, that doesn't really seem right. And it's not. I mean, the total number of cases is important if you're managing a hospital. And for other kinds of applications, it can be an important number. Um, but really, it can also give you the wrong idea because, in fact, the number of people in these age cohorts are different. And if you correct for that, well, yeah, okay, if you correct for that, so you're looking at the case rates, the number of cases divided by the number of people in an age cohort, and you can see that really it remains pretty much flat from about age 50 on. Now, it is higher initially, and the, why that's so, since there's no reason to think that younger adults are more susceptible um, to the virus, is really perhaps related to the mitigation behaviors that we're going to talk about. You see the same kind of issue come up when you look at deaths. So if you look at the total number, you see, oh, more older people are dying. But if you correct for now for the number of people in each age group in St. Louis, you see that the increase in death rates is really quite pronounced. And I'm using these data from St. Louis because our public health department here has a very nice dashboard, and it's easy to get these things. But we're talking about things that are presumably much more general. There's a study cited at the bottom of the page by Williamson et al. It was done in England, looking at all the COVID-19 patients that were treated as part of the National Health Service in Britain, and that's over 17 million people. And basically, you find the same thing, that one of the strongest predictors of mortality, that is, of susceptibility to severe complications from the virus infection, is age. So that makes this whole topic of aging and the pandemic and mitigation behaviors really quite important. And the way that we went about studying this was by making up a questionnaire. We couldn't bring people into the lab, not during the pandemic, but we can study people online, and we can do that by making up a questionnaire that then is administered online. So we asked people about various behaviors and asked them how often did they do this past week? How often did they do it several months ago? Well, actually, when we say how often this past week, these questions were asked in about the middle of April, sort of the peak of the first surge. And therefore, several months ago was really before the pandemic. And what we were most interested in was the mitigation behaviors that were recommended by the CDC, which is the United States Centers for Disease Control and Prevention. And they recommend two kinds of things. Things that you should do, thou shalt, and things that you shouldn't do, thou shalt not. And the thou shalt are really mostly hygiene measures, washing your hands, disinfecting the surfaces in your house. And for these kinds of things, doing them more often is better. For the thou shalt nots, these are really the social distancing kinds of measures. Being closer than 6 feet to someone who's not in your household. Actually having physical contact with someone not in your household. For these kinds of things, less is more. And this is important when we look at the data, because there are some things where it's good if the measure goes up, and for other things, it's good if the measure goes down. Um, or if we're looking at correlations, the sign will change from negative to positive as we go from the distancing measures to the hygiene measures. So in addition to asking people, you know, how often they did things recently and several months ago, we asked them about things that we thought were potential predictors of the mitigation behaviors. Um, this was really kind of a fishing expedition. We had asked about the usual suspects, um, but the good news is that the story we end up being able to tell is relatively simple and I think relatively important. But so we ask people their age, we ask them to rate their health, how much education they had, what their income is, both individual income and household income, um, and how concerned they were about the effects of the pandemic on themselves and about the possible effects of the pandemic on other people. In addition, we asked them about anxiety and depression using the hospital anxiety and depression scale. So more on those, and we'll come back to this in a minute. But we're really interested in things like who engages in mitigation behavior. We got to, what for us as experimental psychologists, it was a large sample that we could do so online. And we got people across a fairly wide age range. We did this by posting 2 hits. One of them was for people of any age. And then to beef up our older adult sample, we posted another one for people 55 and older. And the timing of this study is also kind of important because we recruited people for our study in April when, as I said, it was sort of the peak of that first surge, but also the states of the United States of America were generally under lockdown. The specifics varied from state to state, and the way that was enforced varied from state to state. But there was a general agreement that people should be staying at home. So we didn't have to worry too much about geographical variations adding noise to our data. And the first thing that we found out, and that you see here, is that people did engage in mitigation behaviors. You can, the light gray bars are, the frequency with which people on average said they did things before the pandemic, and the black bars are frequencies done during the pandemic. As you can see, for the social distancing, the frequencies decline and declined a lot. This is a good thing, right? For the hygiene behaviors, things went up. The frequency of things like washing your hands and disinfecting surfaces at home increased, but not nearly as much. And but all these changes were statistically significant. we've got a lot of power, of course, um, with all these participants, but but nonetheless, it's reassuring to know that that things were moving in the right direction. Um, in the meantime, I mean, home hygiene has become less important as a mitigation behavior as people have found out more about how long the virus survives on different kinds of surfaces. And hand hygiene, on the other hand, we probably didn't ask the question quite right. And and also, in fact, the CDC has changed the specifics of its recommendations. But just looking at how often people wash their hands, people wash their hands for lots of reasons, lots of times during a day. Um, they wash before and after they eat. They wash when they use the bathroom. Um, and people vary in the extent to which they do things. So this is basically a very noisy measure. And we're doing follow-up studies now, and we've changed the way that we ask it. So we're really asking things like, well, you wash your hands whenever you come home. That seems to be a much more relevant kind of information, bit of information to get from them, rather than how many times you wash, if you're staying at home, which is a good thing, how many times a day do you wash your hands while you're staying at home? Not necessarily all that relevant to anything. So that was looking at everybody. If we now start to break things down by age, um, we can really see the age trend. And what's happening here is that we're looking at changes, and we're looking at changes because everybody starts with a different baseline. That depends on who they are and their lifestyle and their job and a lot of other things that we're not interested in. So although they might ultimately turn out to be important, but for now we just want to know who's moving in the right direction, which is down. And when it comes to social distancing, and how much are they doing so? And you can see that the older adults, regardless of whether they start higher or lower, are changing more. That is, their change is a more negative number, which is why it's going down when the change is actually larger. But we see it's changing with age, but interestingly, it's also independent of how people rate their health or their concern for themselves, how the pandemic might affect them. Now, this is especially important in figuring out what older adults are up to because their health is poor. And if they were really worried about themselves, if that was the reason why they're showing more change in their mitigation behaviors, that would be one thing. But it turns out that a lot of change in social distancing is really independent of oneself, and at least consistent with that, it's also independent of one's concern for oneself, for how the pandemic could affect you. So there we're looking at the size of the change. The other way to look at it is to see how likely people are to change in the right direction. And it, it's converging evidence that the older adults really are behaving more appropriately than the younger ones. Here we've pitted the those in their 60s and 70s from those in their 20s and 30s. And although everybody, is more likely to decrease um, the frequency of these behaviors, which is desirable, the older adults are more likely. So they are more likely to show adaptive changes in mitigation, and when they do change, they change by a larger amount. One way to look at this, which turns out to be quite useful, is to look at the correlation. Because as you probably saw on previous slide, we're really asking people for categorical responses. So one category is daily, and another category is every other day. But the distances between these different categories is not constant. Just our guesses as to what would work out well in terms of data collection. And so that affects the kinds of analyses that we do. And so we're looking at Spearman's row here. And because for lots of these things, we're asking the same basic question over and over again. Does social distancing change with age? Does social distancing change with health? Does social distancing change with concern for oneself? We do a Bonferroni correction to correct the sort of the likelihood of getting what would otherwise appear to be a significant result. And what we see is sort of consistent with what we saw previously, that social distancing, both decreases in proximity, or let's say, yes, and decreases in the frequency with which one has close encounters, and the extent to which how often people have physical contact with other people outside their house. These things are going down with age. The one thing that also seems to predict it is people's concerns for others. Not so much they're concerned about the effects of the pandemic on themselves, but for how the pandemic might affect other people. We didn't ask them which specific others they were concerned about. It could be just the general community. It could be people in their family. But the important thing is that the reason why social distancing increases, that is, people decrease the frequency of close encounters, for example. Why that changes with age is not because people are worried about themselves and their health, or because of other concerns about themselves. Concern for others is a more altruistic kind of motivation, and it seems to be a more important one here. When we look at other kinds of demographic potential predictors, individual income is not a predictor of mitigation behavior, nor is the amount of education people have gotten. It suggests that social distancing is not affected by one's socioeconomic status, which would go along with their individual income and their educational level, but it is affected by their household income, which says that it's not. It really is more about the financial resources that they have available to them, regardless of where they come from, regardless of whether they're earning this money themselves or other people in their household are, are, are earning it. So household income predicts social distancing, but individual income does not. When we sort of wind up thinking about what all these things mean when we put them together, that one may turn out to be important. So we also looked at the correlations of their mitigation behaviors with their current psychological state. And here we see that these are really the strongest predictors of mitigation behavior. How depressed people report being, how anxious they report being. Although we saw, significant correlations that, survive Bonferroni corrections, there's some other predictors. These correlations are really much stronger. And suggest that one's, psychological state, how much stress you're under, is probably very important. And so the question then becomes for us, well, does this explain perhaps the age differences in the mitigation behavior? Because there are age differences in anxiety and depression. These are fairly well established, not in every study, but in general, this is what you see. And this shows, the changes in anxiety and depression in our own data. Instead, we used this hospital anxiety and depression scale because it's primarily a state measure, not a trait measure. What traits predict mitigation behaviors is another very interesting question. But those kinds of, there's a trait by definition is going to remain, relatively constant whether there's a pandemic or not. But their state anxiety is going to go up, and the likelihood of being depression, being depressed is going to go up. One other nice thing about the HADS, the hospital anxiety and depression scale, is that there are cutoffs that can be used above, so there's scores above which you would suspect that people actually have a disorder. They have an anxiety disorder or depressive disorder. And we can use these caseness, as they call them, cutoffs, in further analysis to try and get at the role of anxiety and depression in mitigation behavior. So what we've done here is we're plotting the, the the change in mitigation behavior. That is, um, to what extent the frequency of close contacts goes down, or close encounters. Um, if we look at the sample as a whole, and there you see, this is what we've seen before, that these behaviors decrease. Now we can throw out everybody who's above the cutoff. So we're going to get rid of the more severe cases of anxiety and depression, and see what happens. And as you can see, when we do that, we go from white dots to gray dots, and the frequency with which people are getting close to one another or contacting one another goes down even further. What that suggests is that the numbers, that the frequencies were as high as they were, even though they, for young adults, were on average, low. Because we're in a sense controlled then for depression and anxiety. When we pick out somebody who's a case, we mean somebody who was above the threshold for either an anxiety disorder or a depressive disorder or both. So, and the correlations with age, these row values that you see, also drop quite a bit, suggesting that, yes, a lot of the reason why people weren't showing more mitigation was because the really anxious and really depressive ones were keeping those frequencies up relatively higher than they would be otherwise. Now, there's still, a relationship, but you can see that the decreases when the changes when we throw out the cases are much larger for young adults and relatively small when we get to the two oldest age cohorts. So they have, in fact, less cases that were excluded, and that then it explains to a fairly large extent, I think, why young adults don't show as much social distancing as older adults. It's because the younger adults are under much more psychological stress for as a result of the pandemic than the older ones are. Now, why younger adults are more affected by the pandemic than older adults psychologically is an interesting question. But that's really not the question that we're trying to get at. We're trying to get at, you know, why, it's sort of the flip side of the question, why are older adults doing more of what they should, according to the CDC? And along with it, why are the younger adults doing less? And anxiety and depression seems to have a lot to do with it. Our results have a number of implications um, for basically for public health. And one of the implications is, as it says there, beware fear messages. Now, fear messages are a traditional public health approach to changing behavior. And basically they say, you know, engage in this healthy behavior or else something awful is going to happen to you. Or don't engage in this unhealthy behavior or else something awful is going to happen to you. Now, such messages can be effective, which is why there's this traditional approach. But they're especially effective when promoting one-time behaviors, like, for example, vaccination, which people are going to be promoting, and which, perhaps to my surprise, are going to require a lot of promotion. But the other thing that fear messages require to be effective is that your efficacy, the efficacy of what you're recommending is clearly established. The problem here, first, as I said, is that most of the mitigation behaviors that are needed in the current pandemic are not one-time events. They're really patterns of behavior that are going to have to be maintained for quite a while yet. And there have been conflicting messages as to their efficacy. Some of them coming from the President of the United States and even some people on his pandemic task force. So these are the kinds of things that undermine the effectiveness of fear messages. But the present findings suggest that there's another reason why they're probably not a good idea to use, at least exclusively, and perhaps not very much at all. It's because the way they motivate behavior is by increasing anxiety, right? You should be anxious about the or else unless you engage in a particular behavior. Or you should be anxious unless you refrain from engaging in some other behavior. Our findings suggest that the last thing you want to do is raise people's level of anxiety. That when you do, in fact, it decreases their tendency to engage in appropriate mitigation behaviors. Increases anxiety and can also increase depression. So not such a good idea. So the question is, well, all right, so what do we do instead? And our findings suggest a couple of alternatives. One of them is to actually promote concern for the effects of the pandemic on others. Concern for others was a predictor of appropriate mitigation behavior. Again, remember, not concern for oneself so much as concern for the effects of the pandemic on others. There are a few studies that have tried using this kind of approach and messaging approach, and they suggest, that it does work. That you want people worrying about their community and what's going to happen to the other people in it. That can be an effective way to motivate them to do things that will not only protect their community but protect themselves too. But you don't necessarily want to present it that way. Another thing that can be done is providing financial support. That's sort of what basically the finding, what's implied by the effect of household income. Now, at least in the United States, promoting this idea may call for some public health message of its own, because the idea that we're going to give people money is not generally considered a good thing by some people. But the important thing I think to stress is that if you do this kind of thing, if you increase the household income, the goal is not necessarily to help the people who you're giving the money to. It's an investment in public health. We're giving you money because it's good for everyone. That hopefully may make it more politically acceptable, which would be a good thing. And as I said, both of these approaches, promoting concern for others and somehow increasing household income, are things that are associated with greater compliance with the CDC recommendations. Now, also, I should point out that holding virtual meetings like this one is a good thing. It's the way to hold meetings, and also it's a good thing. Listening to other people's talks and enjoying it. It'd be nice if we could go for drinks afterwards, but even without it, this is a good thing. So we need to be creative about thinking of the things that we can do and the changes in our lives. And now when we did this, the notion of wearing masks was not widely accepted. Everybody, sort of agreed that doctors and nurses should be wearing masks. But whether they would work on a larger scale and whether they would protect the individual mask wearer was really much more open to question, still somewhat uh, open to question, but things have changed a lot in the pro-mask test direction. So wear your mask. We're asking about mask wearing in our follow-up studies. Um, now that the CDC is recommending it for everyone, and hopefully we do all these things, we will all have a happy and safe New Year. Um, thanks very much for paying attention here, and I hope that's what you were doing. Um, I'm not gonna take any questions. Um, I have hearing problems, and somehow um, Zooming and other things really don't provide the kind of auditory uh, input that I can use effectively. So instead, here's my email address and my cell phone number. So if you have questions, objections, comments, or thoughts on anything relevant, um, um, or you just want to plan what we're going to do next year, send me an email or send me a text. And especially if you send me a text, I will probably get right back. Um, so thanks much, and hope to see you again soon.